Hello, my colleagues and my friends. To continue talking about abdominal pain, let me give you a short mini lecture and short notes on or clinical tips on endocrine and metabolic causes of abdominal pain. Endocrine and metabolic causes of abdominal pain as a group of what we call non-surgical or medical causes of acute abdomen. The most important endocrine and metabolic causes is number one, in patients with diabetes, because diabetes is a common endocrine and metabolic disease, as we all know. It is a cardiovascular metabolic disease, as we reach to a consensus currently about the nature of the diabetic syndrome. And as I mentioned in my previous lectures, mini lectures about presentations about the diabetic syndrome, patients with diabetes might get an acute complication, acute metabolic complication. We call it diabetic ketoacidosis. And these are common metabolic complications or in both type 1 and type 2, but especially common also as a presentation in patients with type 1 diabetes mellitus and in any patient who is insulin dependent and insulin deficient. So the diabetic ketoacidosis might present with abdominal pain due to stretch of the capsule of the liver, due to, as we all know, increased ketogenesis. There is increased ketogenesis and decreased ketolysis and severe hyperglycemia. These are the major metabolic features of diabetic ketoacidosis. And it is pathologically directly related to insulin, absolute insulin deficiency with increased ketogenesis and increased production of ketone bodies and the keto acids, including the hydroxybutyric acetoacetic acid and the acetone in the blood and urine, building them up. Because the main site of formation of these keto acids or ketogenesis and the free fatty acids, of course, the FFA, is in the liver, so we get also inflammation, a sort of inflammatory process in the liver, metabolic inflammation with stretch of the capsule and upper abdominal discomfort or even pain, which is usually subacute upper abdominal pain in complicated patients with diabetic patients with diabetic ketoacidosis. So we get upper abdominal pain related to the liver and to the stomach also, and commonly associated with nausea and vomiting also as clinical symptoms of diabetic ketosis. Commonly, such patients present with severe polyuria, severe polydipsia, dehydration, hypotension, abdominal pain, nausea, vomiting, and in later cases they sink into coma, what we call diabetic ketoacidotic coma. So abdominal pain is one of the abdominal manifestations or abdominal presentation of diabetic ketoacidosis in association with nausea and vomiting. So diabetic ketosis is an important endocrine metabolic cause of abdominal pain, diabetic ketoacidosis. Also, uncontrolled hyperglycemia without ketosis might also cause subacute abdominal pain and discomfort in uncontrolled diabetics with uncontrolled hyperglycemia, even in the absence of DKA. Another important endocrine cause is the hyperparathyroidism. And primary hyperparathyroidism, especially primary hyperparathyroidism, they present with, as we all know, stones and hypercalcemia. These are all related to the hypercalcemia as the main metabolic disturbance associated with primary hyperparathyroidism, whether due to parathyroid hyperplasia or parathyroid adenoma, or rarely parathyroid carcinoma. So causing primary hyperfunction of the parathyroidism, secreting increased amounts of parathyroid hormone, which causes, of course, disturbance in the bone metabolism and disturbance in calcium and phosphorus homeostasis with hypercalcemia. And hypercalcemia can cause nephrocalcinosis, can cause renal stones, they can cause pancreatitis, also hemorrhagic pancreatitis, one of the metabolic causes of hemorrhagic pancreatitis, and this can be the mechanism of how hyperparathyroidism can cause the abdominal pain through producing pancreatitis due to the hypercalcemia associated with hyperparathyroidism. Also, through another mechanism is through the calcium stones associated with hyperparathyroidism. That's why we call hyperpara is a disease of stones, bones, and bronze, because it affects the kidneys, it affects the abdomen, it affects the brain, it affects the pancreas, it causes stones, it causes moans, it causes groans, psychic moans, it affects the brain and the mental functions. So it affects the kidney, it affects the pancreas, it affects the gut, it affects the brain, it affects the heart, the primary hyperparathyroidism. So one of the presentations of primary hyperparathyroidism is uncontrolled hyperparathyroidism with hypercalcemia is abdominal pain. Another important endocrine disease which presents with abdominal pain. Don't forget hyperparathyroidism in that we have to use and we have to ask for serum calcium and phosphorus and the parathyroid function and parathyroid hormone, and being suspicious of hyperparathyroidism in some individual cases presenting with abdominal pain as a medical cause of abdominal pain. A third cause, endocrine cause, is patients with thyroid disease, especially hyperthyroid patients. Patients with hyperthyroidism or thyrotoxicosis, they might present with stomach pain, especially upper abdominal pain. And especially in complicated thyrotoxicosis with thyrotoxic crisis or thyroid storm. One of the features of thyroid storm, in addition to the increased sympathetic overtone, the tachycardias, tachyarrhythmias, the fever, is vomiting and abdominal pain. So thyrotoxic storm might present with abdominal pain as a acute thyroid emergency, complicating uncontrolled hyperthyroidism or uncontrolled thyrotoxicosis, thyroid storm. Also, patients with hypothyroidism, the opposite or the other way around, the hypothyroidism might present with stomach pain and abdominal pain, which has different mechanisms, one of which is the autoimmune nature of hypothyroid disease as the underlying cause of the thyroid hyperfunction. And this might, one of the syndromes is autoimmune thyroiditis and autoimmune adrenalitis and autoimmune gastritis with pernicious anemia, macrocytic anemia. So especially noticeable in patients with autoimmune disease involving the thyroid, the adrenal, the stomach with macrocytic anemia. That's why if we find macrocytic anemia with abdominal pain, search for thyroid function, search for other associations. So hypothyroidism can also be present with abdominal pain directly and indirectly through associated pernicious anemia and macrocytic anemia, I mean macrocytic megaloblastic, and involvement of the stomach with autoimmune gastritis. This is one of the mechanisms, but it has other mechanisms of abdominal pain in patients with thyroid failure. Direct and indirect mechanisms. So thyroid failure can present with abdominal pain. Other endocrine causes other than the hyperpara and the hyperthyroidism and the hypothyroidism and the diabetes, we have also adrenal patients. Patients with, as I just mentioned, autoimmune adrenalitis, and this causes Addison's disease or adrenal hypofunction. One of the features of adrenal function is abdominal pain. We all know that adrenal hypofunction, Addison's disease, which is chronic adrenocortical insufficiency, it might present with abdominal discomfort, nausea, vomiting, diarrhea. And especially patients with complicated acute adrenal failure, that's Addisonian crisis, they might present with more severe abdominal pain and with hypotension and shock even, and vomiting. So be careful that vomiting and shock of course, one of the features of the shock syndrome is hypotension. Especially if we find on blood chemistry hyponatremia and hyperkalemia and rise of the blood urea nitrogen, we should think about Addisonian crisis as the cause of abdominal pain. So post-chronic adrenocortical insufficiency and acute on chronic adrenocortical insufficiency, which we call it acute adrenal crisis, might be the cause of abdominal pain, acute abdominal pain. So the adrenal, the parathyroids, the thyroid, the diabetes, these are all potential endocrine causes of abdominal pain. Then we come to other metabolic causes of abdominal pain. You can consider them among the endocrine or among the metabolic causes. Among the metabolic causes of abdominal pain, we have the abdominal pain in patients with hemochromatosis. And here the abdominal pain in patients with hemochromatosis is related to many factors, and we call it abdominal crisis in hemochromatosis. Hemochromatosis is a metabolic disease with iron overload in the different tissues of the body with multisystemic involvement. Hemochromatosis most commonly involves the liver, and it might cause liver cell failure, and even might predispose to hepatocellular carcinoma, and these are two common modes of death in patients with hemochromatosis. The involvement of the liver and also involvement of the pancreas with pancreatic failure and pancreatic insufficiency, endocrine and exocrine. And it can cause secondary diabetes, hemochromatosis, due to pancreatic destruction. Also, hemochromatosis can involve the heart with a form of cardiomyopathy. We call it congestive or dilated cardiomyopathy and restrictive cardiomyopathy in patients with hemochromatosis. Also, it can involve the brain. It can involve the genital organs and cause hypogonadism. It can involve the pituitary. It can cause also iron deposition in other neural structures in the CNS. It can involve, as I mentioned, the testes and ovaries and cause hypogonadism due to iron overload in the gonads and genital organs and causing hypogonadism. So there is multiple features of hemochromatosis, and here I'm speaking about the primary hereditary hemochromatosis characterized by iron overload with destruction of the different organs and causing organ failure. Different organ failure, especially the liver and pancreas and the heart. One of the presenting features is in the form of abdominal manifestations of hemochromatosis. We call it metabolic crisis or abdominal crisis in hemochromatosis with nausea, vomiting, and maybe also constipation or diarrhea. Sometimes we see constipation, sometimes we see diarrhea in hemochromatosis due to involvement of the gut, direct involvement of the gut, or due to involvement of the pancreas by pancreatitis, or involvement of the liver by hepatic hemochromatosis, ending in a form of liver cirrhosis, as I said, and also might be predisposing to development of cancer in the liver, hepatocellular carcinoma complicating hemochromatosis involving the liver. And this is one of the metabolic liver diseases. That's the metabolic causes of a liver disease. So hemochromatosis can present with abdominal pain. So this is also one of the metabolic causes of abdominal pain. Also I mentioned it yesterday, the porphyria, which is related to porphyrin metabolism, and acute intermittent porphyria is a type of porphyria, and porphyria is a big syndrome with many varieties and many types. One of the common types which present with abdominal pain is the acute intermittent porphyria. And in this porphyria, which is related to abnormality in porphyrin and hemoglobin metabolism, which is part of the hemoglobin, it is related to heme metabolism, causing the accumulation of porphyrins, uroporphyrins and the coproporphyrins, and this cause a sort of an intermittent porphyria with an acute intermittent abdominal pain, and with other features, of course, of porphyria. So abdominal pain, like disturbance in the blood pressure, in the pulse, skin manifestations, urinary manifestations, etc., of acute intermittent porphyria. So acute intermittent porphyria can present with abdominal pain, and it's one of the metabolic causes of abdominal pain. This is the endocrine metabolic causes of abdominal pain. Don't forget this. Yesterday I mentioned the blood diseases or hematological causes of abdominal pain, and it's also important to remember what are the hematological causes of abdominal pain. I mentioned them yesterday in my talk, first episode, talking about acute abdominal, medical causes of acute abdomen. Thank you so much, and I will see you in my future upcoming presentation. Have a nice day, all of you.